Hey there, welcome. Today, we're going to pull back the curtain on something amazing, something that's happening inside you right now. We're talking about how your body turns the food you eat into actual fuel. It's a fascinating story, so let's jump right in. I mean, have you ever really thought about it? How does that slice of pizza or that morning banana literally become the energy that powers your brain to think, your muscles to move, and your heart to beat? Well, we're going to follow that journey today, all the way from your plate down to the tiniest cell. Okay, so to really get this, we've got to meet the main characters in this whole biological production. There are just a few key players, but trust me, each one has a super important job. All right, first up, meet the hero of our story, glucose. Basically, whenever you eat carbohydrates, bread, pasta, fruit, your body breaks them down into this simple sugar. Think of glucose as high-octane fuel for your body. It's what powers, well, pretty much everything you do. And I mean every part of you is hungry for it. From your brain cells firing to the cells repairing a paper cut, they are all like tiny little engines constantly screaming for this glucose fuel to do their job. But there's a catch. Glucose can't just wander in the front door. So, how does the body manage this whole fuel delivery system? Well, say hello to the pancreas. This amazing little organ, kind of tucked away behind your stomach, is basically mission control. It's on duty 24/7, just constantly checking the fuel levels in your blood. And the process is actually pretty straightforward. You eat a meal. That food gets broken down, and boom, glucose hits your bloodstream. So your blood sugar starts to go up. The pancreas sees this and goes, all right, fuel's here. And in response, it immediately sends out a very special messenger. And that special messenger, you've definitely heard of it. It's called insulin. Insulin is a hormone, and its job is, well, it's absolutely crucial. This is where the magic really happens, because insulin is the solution to getting that fuel where it actually needs to go. To really get what insulin does, let's use a super simple analogy. Just picture every single one of your body's trillions of cells as a tiny little house, and every single one of these houses has a locked door. So here's the problem. Our fuel, that glucose, is just floating around in the bloodstream. You can think of the bloodstream as the streets in this neighborhood of houses. The glucose makes its way right up to the front door of a cell, but the door's locked. It's stuck outside. It can't get in. And this is the whole point. Insulin is the key. When your pancreas sends out that insulin, it travels through the bloodstream, finds those locked doors on the cells, and it fits perfectly into the lock. It turns the key and click. And just like that, the door is open. A little channel opens up and the glucose can finally rush inside. The cell gets its fuel, it's happy, it can do its job. And, just as importantly, your blood sugar level goes back down to normal. It's a beautiful, elegant system when it's working right. But what happens when that perfect system breaks? When the key and the lock stop working together? Well, that's when we get to the real heart of our story today. Because that breakdown, that's what we call diabetes. Now, the official medical speak for it is pretty dense, something about a disturbance of carbohydrate metabolism. But let's just cut through all that. All it really means is that the body has a major problem using its fuel because something's gone wrong with insulin. And the end result? Way too much sugar gets stuck floating around in the blood. So let's go back to our analogy of the houses and the keys. If the whole system is broken, it really comes down to one of two things, right? Is there a problem with the keys? Or is the problem with the locks on the doors? And that's it. Those are the two core problems. So on the one hand, maybe the body just isn't making enough keys. The pancreas can't produce enough insulin to go around. That's called insulin deficiency. Or on the other hand, maybe the body is making plenty of keys, but the locks on the cell doors are all messed up. They're jammed, they're rusty, whatever it is, the key just won't work anymore. And that is called insulin resistance. So whether you don't have enough keys or the locks themselves are broken, the end result is exactly the same. The glucose can't get into the cells. It gets trapped in the bloodstream, and the levels just keep getting higher and higher. And what's really wild is you end up in this situation where the body is literally swimming in fuel, but the cells themselves are totally starving for energy. And when that happens, your body starts sending out some pretty clear warning signs. Your kidneys go into overdrive, trying to flush out all that extra sugar, which is why people often have to pee a lot and feel super thirsty. And since your cells are starving for that fuel, you can feel intensely hungry but actually lose weight.
It makes sense, right? Your body just isn't getting the energy it needs, which can also make you really tired and more likely to get infections.
This brings us to the big question, the final piece of the puzzle. What is the real difference between having no keys and having a bunch of jam locks? I mean, both problems lead to high blood sugar, but the root cause is totally different. One is a manufacturing problem, not enough keys. The other is a lock problem. The keys just don't fit. Well, that right there, that is the fundamental story of type 1 versus type 2 diabetes. And to find out which is which and what that all means for the millions of people living with these conditions, you're going to have to join us for our next explainer. We'll see you then.
Hey, welcome. In this explainer, we're going to tackle diabetes. We're going to decode some of the really important signals our bodies can send us, and then break down exactly how doctors figure out what's going on. Let's dive right in.
So does any of this sound familiar to you? You know, that feeling where you just can't drink enough water, or you feel like you're constantly looking for a bathroom? Well, these aren't just little annoyances. They could actually be your body's way of trying to tell you something important. We're going to figure out what those signals mean.
All right, first things first, let's do a quick intro. Before we jump into all the signs and symptoms, we've got to understand what diabetes actually is on a basic level.
At its very core, diabetes mellitus is all about a problem with how your body handles sugar. Now think of sugar as the fuel that powers pretty much everything you do. Diabetes is what happens when your body just can't get that fuel into its cells the right way, and that causes it to pile up in your blood.
Okay, so let's talk about those warning signs. In medicine, there are these classic symptoms of diabetes that are sometimes called the 3 Ps, and you'll see why they are such powerful clues that something's not quite right with your body's entire fuel system.
The first P is polyuria. Now, this isn't just about needing to use the restroom a little more often than usual. We're talking about a huge increase in how much you're going, sometimes even more than 3 liters a day. For a lot of people, this is one of the very first things they notice.
And that leads us straight to our second P, polydipsia. This is that intense, can't get rid of it thirst. And it makes total sense, right? If your body's losing all this fluid, it's going to scream at you to replace it. It's basically the body's emergency response to fight off dehydration. Our third P is polyphagia, which is just a fancy word for extreme hunger. Now, this is where things get really interesting, kind of paradoxical. You're eating more, maybe you feel hungry all the time, but you might actually be losing weight. This is a massive clue about what's really going on inside your body's cells, and we'll get to that in just a second. So, we've covered the what, those 3 Ps. Now let's get into the why. Why does all this happen? Well, it all comes down to the science of how our bodies are supposed to use sugar for energy.
Normally, this system is incredibly efficient. It's beautiful, really. You eat, your food breaks down into sugar, or glucose, and your pancreas releases a hormone called insulin. So the most important thing to remember here is that insulin works like a key. It floats through your blood, finds the little doors on your cells, and unlocks them so that glucose, the fuel, can get inside and power you up.
And this shows you exactly where the system breaks down. With diabetes, that insulin key is either completely missing, which is what happens in type 1, or the lock on the cell door is kind of jammed, so the key doesn't work right, which is what we see in type 2. So what happens? All that sugar fuel gets stuck outside, floating around in the blood. Your cells are literally starving, which is what triggers that intense hunger, polyphagia. And at the exact same time, your kidneys kick into overdrive trying to flush out all that extra sugar, which leads directly to the frequent urination, or polyuria. And here's where it all connects into a vicious cycle. As your kidneys are working so hard to filter out all that extra sugar, a ton of water gets pulled out right along with it. The technical term for this is osmotic diuresis. This process is what causes those huge volumes of urine, which then leads to dehydration. And that dehydration is what triggers that overwhelming thirst, or polydipsia. See? It's just this powerful, exhausting chain reaction. Okay, so your body is sending out some pretty clear signals, but to really know for sure, how do doctors get a definitive answer? Let's move on and look at the medical tests that give them that certainty. One of the most common starting points is the fasting blood sugar test. It's a really simple blood test, but the fasting part is absolutely crucial. It means nothing to eat or drink except water for at least 8 hours beforehand. This gives doctors a clean baseline reading of your blood sugar levels without a recent meal messing with the numbers. Another really important tool is the hemoglobin A1C test. Now this one's different. It's not just a snapshot of a single moment. It actually measures how much sugar has been sticking to your red blood cells over the past 2 to 3 months. That's why calling it a report card is the perfect analogy. It gives a much bigger, more reliable picture of how your blood sugar has been doing over the long haul.
And what's great about this is just how clear the numbers are. Doctors use these specific cutoffs to diagnose not only diabetes, but also pre-diabetes, which is like a warning stage. So for an A1C, if you're at 6.5% or higher, that's a diabetes diagnosis. For that fasting test, it's 126 or more. These numbers aren't guesses. They're the established medical standards.
So you understand the signs, you've got a diagnosis that's been confirmed by the numbers. What in the world does that mean for you now? Let's talk about the path forward.
And this is absolutely the most important point. A diagnosis is not some kind of final verdict. It's the exact opposite, really. It's the critical piece of information you need to start taking action. It gives you and your doctor the power to build a plan with diet, exercise, maybe medication, to manage your health and take back control of your life.
So we've talked about the immediate signs, right? Those 3 Ps that tell you there's a problem right now. But there's a reason you hear that managing blood sugar is so important. Getting the diagnosis gives you clarity for today, but what does all that extra sugar in the blood do to your body over years? To your nerves, your eyes, your heart? Well, that's what we're going to explore in our next explainer.
Welcome! In this explainer, we're going to break down diabetes. We'll get right to the heart of what makes each type different, and we're going to start with a simple question about how our bodies work every single day.
So think about it. You eat a meal, and somehow your body magically turns that food into the fuel you need to live, to work, to think. But how does that actually happen?
Well, believe it or not, that whole incredible process really hinges on one special little key. And understanding this key, and the lock it's meant to open, is the secret to understanding the different types of diabetes.
Okay, so before we get into what can go wrong, let's look at the blueprint. How is your body designed to handle energy when everything is running perfectly?
It's actually a pretty elegant 3-step process. First, the food you eat gets broken down into a sugar called glucose. That's the fuel. Then, an organ called the pancreas, let's call it the factory, releases our special key, a hormone called insulin. And finally, that insulin key goes and unlocks your body's cells, opening the door so the glucose can get inside and power everything you do. Simple, right?
It's a finely tuned system for sure, but it can be disrupted. So what happens when there's a problem at the factory? Or what if the locks on the cell doors get jammed?
And that's where we get the official medical term, diabetes mellitus. At its core, it's a condition where the body has trouble managing sugar. This happens for one of 2 main reasons. Either there isn't enough insulin, that's an insulin deficiency, or the body just can't use its insulin properly. That's called insulin resistance. But in either case, the result is the same. Too much sugar gets stuck and builds up in the blood.
Okay, so let's get specific, starting with type 1 diabetes. The easiest way to think about this one is as a problem with the factory itself.
So, what's causing this factory problem? Well, in type 1, the body's own immune system gets confused. It's a case of mistaken identity. It wrongly sees the insulin-producing cells in the pancreas as a threat, and well, it attacks and destroys them. This is what we call an autoimmune disease.
This flowchart shows us how that can happen. See, a person might have a genetic predisposition. They're just more susceptible. Then something in the environment, maybe a virus, acts as a trigger. That trigger kicks off the autoimmune response, which leads to the destruction of those crucial insulin-making cells, creating a shortage of keys and, eventually, diabetes.
And this graph gives us an even closer look inside the factory. It shows the percentage of working beta cells. Those are the specific cells that make our insulin keys. With type 1, you see this really steep decline as the immune system destroys them. The factory is, quite literally, shutting down production.
And here's the really stunning part. There's a critical tipping point. The source material tells us that it's only when a massive 80 to 90% of these cells are gone that symptoms usually start to show up. Our bodies are incredibly resilient, but they just can't compensate forever.
So the takeaway here is crucial. With type 1 diabetes, the factory can no longer produce enough insulin keys. And without those keys, sugar can't get into the cells to be used for energy. It's locked out, just building up in the bloodstream.
All right, let's switch gears and talk about type 2. This is a completely different picture. If type 1 is a factory problem, type 2, well, that's a lock problem.
So, in type 2 diabetes, the factory is still producing insulin. It's working, at least at first. The problem is with the locks on the cell doors. For various reasons, they've become resistant or kinda jammed.
So even though the insulin key is there, it struggles to unlock the door. It's not working effectively, and the sugar still has a hard time getting inside.
So what causes these locks to get so jammed up? Well, there are several common risk factors. Things like being overweight, not getting enough physical activity, and having a family history of diabetes are big ones. And other factors, like belonging to a high-risk ethnicity or having a history of high blood pressure, can also increase that risk of insulin resistance.
This chart really puts it all into perspective. While both types are serious, type 2 is overwhelmingly more common. It accounts for about 90% of all diabetes cases out there. Type 1 makes up most of the other 10%.
Now, before we summarize everything, there's one more important type we should mention briefly, and that's gestational diabetes. You can think of this as a temporary version of that lock problem we just talked about. During pregnancy, hormones from the placenta can actually interfere with insulin's ability to do its job. It's a form of insulin resistance that, for most people, resolves after the baby is born.
Okay, we have covered a lot, so let's pull it all together now into a really clear, side-by-side overview. This table makes the comparison crystal clear. For type 1, the core problem is an insulin deficiency, not enough keys. It usually shows up in people younger than 30 who are often at a normal weight or underweight, and taking insulin is always necessary. Now, for type 2, the core problem is insulin resistance. The locks are jammed. This tends to start in people over 40 who are often overweight, and insulin might not be needed right at the beginning.
Let's just boil this entire explainer down to its absolute simplest takeaway, using our key analogy one last time.
Here it is, the simplest way to remember the difference. With type 1, it's a factory problem. There are not enough keys. With type 2, it's a lock problem. The locks just don't work properly.
So, understanding the what and the why is a huge first step. But the next really crucial piece of the puzzle is knowing how to spot the signs that something might be wrong. How does your body actually tell you that sugar is building up in your blood?
We are going to cover exactly that, the classic symptoms and warning signs of diabetes, in our very next explainer. Thanks so much for watching.
All right, let's dive right in. We're going to be talking about something that affects millions of people, but here's the thing. It's a condition where you have so much control. Today, we are building your personal empowerment toolkit. We're going to take all that complicated medical stuff and turn it into simple, clear steps so you can take charge of your health.
So maybe you've just been diagnosed. And if you have, I bet you're feeling a little overwhelmed. That is totally normal. But I want you to try and flip that script in your head. This is not some dead end. Think of it as a new path. A path you can totally navigate once you have the right tools. And that is exactly what we're going to give you today. So let's get into it. So what exactly is diabetes? Well, at its most basic level, it's all about a little hiccup in how your body handles fuel. So your body is supposed to take sugar, or glucose, from your blood and use it to power your cells. With diabetes, that process doesn't work quite right, so the sugar ends up hanging out in your bloodstream, and that can cause problems down the line. To get a handle on this, we've broken everything down into your own personal management toolkit. We just touched on what diabetes is. Next, we're going to open up your medication toolkit. Then we'll talk about fueling your body the right way. And finally, we'll get into the power of movement. After all that, we'll bring it all together into one simple plan. Okay, first up, medication. Now, let's get one thing straight. Taking medication is not a weakness, not at all. It's actually one of the most powerful tools you have in your kit. It's all about working with your body to get that blood sugar back under control. So, when it comes to diabetes meds, they usually fall into two big categories. On one side, you've got insulin. For anyone with type 1 diabetes, this is essential, and sometimes it's needed for type 2 too. It's basically just replacing the insulin your body isn't making. Then, on the other side, you have oral medications. These are pretty clever. They work in all sorts of ways, like helping the insulin you do have work better, or finding other routes to lower your blood sugar. The best way to think about insulin is with this analogy. Imagine insulin is a key, and all the cells in your body have tiny little locks on them. For the cells to get the fuel, the glucose, they need, those doors have to be unlocked. So when you take insulin, it travels through your blood, finds those cells, and click, it unlocks the door. That lets the sugar move from your bloodstream into the cell to be used for energy. Simple as that. Now let's talk about one of the most common oral meds out there, metformin. So if insulin is the key that opens the cell door, I want you to think of metformin as the traffic controller for all the sugar in your body.
It doesn't make your body produce more insulin. Nope. It just gets smarter about managing the sugar that's already there.
So how does this traffic controller do its job? Well, it does 3 really smart things. First, it puts up a little stop sign and tells your liver, hey, release less sugar. Second, it makes your muscles more receptive to that insulin key, so they can grab sugar out of the blood more easily. And third, it slows down the speed limit for how quickly sugar gets absorbed from your food. And here's a really important bit. Unlike some other meds, metformin by itself doesn't usually cause your blood sugar to drop too low.
Okay, let's move on to the next tool in our kit. This is the diet pillar, and this is all about empowering yourself with the food you choose. This isn't about feeling deprived, you know? It's really just about finding the right balance.
The source material gives us a pretty solid blueprint for that balance. If you look at your total calories for the day, the goal is about 50% from carbohydrates, 30% from fats, and 20% from proteins. But, okay, what does that actually look like on your dinner plate?
This is where it gets really simple. Seriously, forget counting every little thing for a second and just picture your plate. You're gonna fill half of it, the whole half, with veggies, like broccoli, salad, green beans, you name it. Then fill 1/4 with some good lean protein, like fish or chicken. And that last quarter, that's for your high fiber carbs, like brown rice. It's a super easy way to hit those nutritional goals without driving yourself crazy.
And that brings us to our final pillar, and maybe the most powerful one, exercise. Now, this doesn't mean you have to go run a marathon tomorrow. It's about using your body's incredible natural ability to manage blood sugar just by moving.
Here's the main idea I want you to remember. Your muscles are like these amazing engines. And what do engines need? They need fuel. And what's their favorite kind of fuel? You guessed it, sugar, glucose. So the moment you start moving, I don't care if it's walking, swimming, or just dancing in your living room, you're sending a signal to those muscle engines to fire up and start burning fuel. And they do it by pulling sugar right out of your bloodstream. It's one of the fastest, most effective ways to lower your blood sugar, and it's all natural.
Okay, so what's the magic number we're aiming for here? The guidelines all point to this one, 150.
That's right, 150 minutes of moderate activity a week. And before you think that sounds like a huge number, let's just break that down. It's just a little more than 20 minutes a day. That's it. A quick, brisk walk on your lunch break, a little bike ride after work. It's so achievable, and the payoff for your health is massive.
So we've gone through the 3 pillars, right? Medication, diet, and movement. Now let's put it all together into one simple toolkit that puts you right in the driver's seat of your own health.
And here it is, your whole toolkit, all in one place. Your medication directly manages blood sugar. Your first step is just to talk with your doctor. Your diet gives you steady energy. Try that balanced plate method for your very next meal. And movement helps burn up that extra sugar. Why not go for a 20-minute walk today? See, every tool has a clear job and a simple first step you can take right away.
I really want to leave you with this idea. This isn't just about giving you information. This is about empowerment. You have the tools. You have the knowledge. You absolutely have the power to manage this, to take care of your health, and to live a great life. And just so you know, what we've talked about today is actually the final piece of our entire 5-part series on understanding diabetes. We've taken you all the way from the initial diagnosis to this complete management plan.
So if you found this helpful, or if you can think of even one person who could use this information, please share this entire playlist with them. Because giving someone the right knowledge, well, that's the first step to empowering them too. Thanks for joining us.
Welcome to The Explainer. Today, we're going to talk about what happens inside your body when diabetes isn't managed. We're going to get real about the hidden dangers of high blood sugar. But, and this is the important part, we'll also show you why there's so much reason for hope. To really wrap our heads around this topic, let's start with a really simple but powerful idea. Just imagine, for a second, that your blood, which is supposed to zip around to every single part of your body, suddenly got thick and sticky, kind of like syrup. You can see how that would be a problem, right? This syrupy effect, which is caused by too much sugar, puts an incredible amount of stress on the massive network of blood vessels in your body. It's like trying to force honey through a tiny straw. Over time, that pressure and that stickiness, well, it starts to cause some serious damage from the inside out. Okay, let's get into it. The easiest way to think about this is to picture your body's circulatory system as this incredibly complex plumbing network. And the damage from that syrupy blood, it really breaks down into 2 main types of problems. Issues with the tiny, delicate pipes, and problems with the big main supply lines.
Now, there are some fancy medical terms for this. You've got microangiopathy and macroangiopathy. Micro, just like it sounds, refers to the damage done to the smallest, most fragile vessels, the ones feeding your eyes, your kidneys, and your nerves. And macro refers to the damage to the big guys, the major arteries, which can lead to huge problems like heart attacks and strokes.
So before we get into the slow, corrosive damage that can happen over many years, we've got to talk about the sudden emergencies. You know, the burst pipe scenarios that can happen. These are what we call acute complications. And here's a twist that might actually surprise you. We've been talking all about the dangers of high blood sugar, but the single most common diabetic emergency is the exact opposite. It's called hypoglycemia, and it means your blood sugar is dangerously low.
This table is awesome because it shows you just how different these two emergencies are. Notice how a low sugar crisis comes on really fast and you get all sweaty, but a high sugar crisis, or DKA, is usually a slower burn. You get dry skin and a very specific fruity smell on the breath, kind of like nail polish remover. Knowing these signs, absolutely life-saving.
You know, your body is actually pretty smart. It sends out these loud warning signs when sugar levels start to tank. First, you get what are called adrenergic symptoms. That's your body's adrenaline kicking in. You feel shaky, sweaty, your heart pounds. If that doesn't get fixed, the brain starts running out of fuel, which leads to confusion. And in the worst cases, even a coma. All right, let's shift gears and look at that slow, corrosive damage we mentioned, the kind that happens when blood sugar stays high over time. We're talking about microangiopathy again, and we're going to start with the eyes and the kidneys. Think about it. These organs are just packed with these tiny microscopic blood vessels doing really precise work. In your retina, they're capturing light. In your kidneys, they're filtering your blood. So it makes sense that they'd be incredibly vulnerable to that thick, syrupy blood flow we talked about.
And this picture shows exactly what happens. When those little pipes in the back of the eye get clogged, the tissue around them starts to starve for oxygen. It basically panics and sends out these chemical SOS signals screaming for a new blood supply.
So the body tries to help. It starts building new blood vessels, a process called neovascularization. But this isn't a high-quality construction job. It's a desperate, rushed one. These new vessels are fragile, they're weak, and they leak all over the place. And that leaking and bleeding inside the eye can cause serious, serious vision damage. This right here illustrates the whole progression perfectly. This is called diegetic retinopathy. It starts out pretty mild, with just a few little leaks. That's background retinopathy. But if it keeps going, it progresses to this proliferative stage, where all those fragile new vessels start growing. And that's when the real risk to your sight begins. And you know what? It's basically the same story in the kidneys. That same leaky, desperate repair process happens there too. Your kidneys have millions of tiny little filters. That syrupy blood clogs them up, damages them, and they start leaking things they're supposed to keep, like protein. This is called diabetic nephropathy, and over a long time, it can lead to complete kidney failure. So the damage isn't just to the plumbing. Your nerves are living tissue. They need their own tiny blood supply to work. So when that syrupy blood starts clogging up those little vessels, it also starts to damage the body's electrical wiring, the whole nervous system. This damage to the wiring is called diabetic neuropathy. And it's not just one single thing. It can mess with the signals from your senses, the signals to your muscles, and even the signals that control all the automatic stuff your body does without you thinking about it. The most common kind affects the sensory nerves. People describe it as a stocking and glove feeling, numbness or pain that starts in the feet and hands and works its way up. But even more dangerous can be autonomic neuropathy. This is when the nerves controlling your automatic systems get damaged. This can mean you don't feel the warning signs of low blood sugar, or worse, you could have a heart attack and not even feel the chest pain. A silent heart attack. Okay, we've talked about the small pipes and the wiring. Now let's zoom out and look at the big stuff, the main plumbing lines. We're talking about the major arteries that supply your heart, your brain, and your limbs. The scientific name for it is atherosclerosis, but you probably know it as hardening of the arteries. For people with diabetes, this whole process gets put on fast forward. It happens way more and at a much younger age. That syrupy blood helps build up these fatty plaques, which narrow those main lines and make them stiff. And this clogging of the main lines? This leads to the most serious complications of all. We're talking coronary artery disease, which raises the risk of a heart attack. It can cause peripheral vascular disease, which chokes off blood flow to the legs and feet. And it massively increases the risk of a stroke. In fact, these big cardiovascular events are the #1 cause of death for people with diabetes.
Wow, okay. We have covered a lot of really serious stuff, from burst pipes to the slow corrosion of the whole system. But I want to finish on what is, without a doubt, the single most important message in this entire explainer. It all comes down to this: the problem, that thick, sugary blood damages the pipes. The effect, that failing plumbing harms the entire house, your body. But the solution, and please hear this part loud and clear, is that none of this has to happen. Almost all of this damage is preventable.
And that really leads us to the most empowering question there is. Knowing the risks is one thing, but what do you do about it? How do you take the controls and make sure your system keeps running smoothly for years and years?
Because knowledge truly is power. Knowing what can go wrong is what motivates you to make sure it goes right. And in our next explainer, we are going to hand you the toolkit, all the strategies, the habits, and the techniques you need to manage diabetes effectively and protect your body for the long haul.